Good evening, members, and welcome to our AAIP treatment planning session. Tonight we're going to go over a recent case that we've had, and that way we can show you what we see and what we do with these patients. We're going to take, well, Dr. Sheldon's going to take a very, very long vacation, and we will start back with our January sessions, January 18th. So please keep note of that the next webinar that we have will be January 18th. That's a Wednesday at 8 o'clock Eastern Time. And that one will be for an effective staff meeting. So we're going to start going over some organization communications to sharpen that area with staff. We will also be in Orlando on January 25th. That will be for the Seattle Study Club. So if you're going, please be sure to come by and see us then. We'd love to see you guys. I think that's all we have for January. Seems like we have a lot of things going on in January.
Yeah, there's some state meetings coming up and things like that, but we will let you know as they occur. No reason to know that now.
We are preparing for some neat stuff starting in January. We're brainstorming on some new packaging, some new products, some new stuff going on, so we will be announcing those at the end of January as well. But today, we'll do some treatment planning.
So let's do some treatment planning. Let's talk about a case, and let me just get organized here, and let's do that. We've entitled this one, You Have Choices, because patients have choices. And part of this is I want to make sure that we understand that we're dentists first and periodontists second. We are treatment planners first. We are treaters second. In order to be able to do what we do, in order to be able to pull off what we're talking about, we take the lead role in not only marketing to patients, we take the lead role in treatment planning patients. And for those of you who are my age, you're used to that. And for those of you that are Danielle's age, you're not. So I want to reorient you to where we are and where we need to be as the leaders of our profession. I'm going to show you a little bit of that tonight. And also now that we've gone through our entire format of how we do our treatment plans, and not just our treatment plans, but how we work with our patients, we're going to incorporate that into this particular treatment planning session. Okay, so the patient called in. Remember, the intake phone call is the first contact the patient has with us. The patient makes his or her decision as to whether they're going to make the appointment with us based on whatever that phone scheduler says. So Samantha answered this, and referred by magazine rack in Publix, patient finally decided to pick up our magazine and finally take care of herself. She knows that she needs extensive work done. She's not been to a dentist in a number of years. Patient does have a tooth on the lower right where a cap came off. She's not chewing on that side, and she says that it's not bothering her. I told her about our emergency visit, but she said that was too much for no pain. Our emergency visit is if you need to come in right away, if you have pain, then instead of the $79, you have to pay something like, what, $249, something like that?
Yes.
Yeah, to come in. And that's usually will discourage somebody unless they're really in a lot of pain. We told her about Premier. Premier is a walk-in clinic, and said to give them a call or just walk in if pain does happen, and said they will take care of the immediate problem. Then we'll see her and see what's really going on, treat her overall. I explained the $79 consultation of financing companies. Patient is excited to finally make her mouth a priority, scheduled to speak with me on, at that time it was August 8th, and the appointment was set for August 15th. So what does this tell you? Number one, she was in Publix, food store in the area, saw a magazine. She's probably been seeing that magazine at least once a week for 2 years. As she goes to Publix and she exits Publix and she looks at the magazine rack, and there is that magazine just staring her straight in the face. Was she ready to do something 2 years ago? No. Was she ready to do something now? Yes. And she keeps on seeing that magazine. Oh, finally, I'll pick up that magazine and see what this is all about, because it says something like Space Coast Dentist. We'll see what that is all about. Talk about repeated contact. Patient was in Publix kept on leaving Publix, kept on staring at that, scratching her head and say, well, maybe that will be me someday, but not right now. And for some reason, she had a need on August 8th, and she called us. That's how advertising works. That's how marketing works. It's repeated touches, not badgering somebody, but repeated touches until somebody finally decides to buy. Just like that's just the reason you bought the particular car you bought. It's the reason you bought the particular clothes you bought. It's the reason that you see something on TV and look on Amazon and see how much it costs there. And you didn't look at it the first time. You didn't look at it the second time. But, you kept on seeing it 7, 8, 9 times. You said, oh, maybe I do need this thing. Let's take a look. And that's how marketing works.
We covered that before, and I remember one of these webinars that we did, someone asked you, what should I do? What's the one thing that I can do that will get the attention and get people to start calling the phone direct to patients? And when we do our stats, which all of you know, we're stat happy here, we stat everything. The stats show that the new patients that come here, they've heard about you and they've been seeing you for a long period of time, and they have been touched by different things. They've seen you on a TV, they heard you on the radio, they came to an implant seminar, they saw you in the paper, they got something in the mail, a friend talked to them about it. And usually I think it's rare that we see somebody ever come in here with one touch, that has heard from you from one area.
Yeah, it's true. And so we all need to concentrate on repeated touches, just as you're working with your referral sources on repeated touches, aren't you? So it's the same way, same work that way. Okay, so the next is the doctor phone call. And actually, Sam was really, really complete, and I will only add to what Sam said. So I make the phone call. Those are my initials up there. And essentially, it's 2 years ago. She was told she had a lot of bone loss on the bottom. She was sent to a periodontist. She never went. So apparently 2 years ago, she did see a dentist for examination. And I say, based on the description that Sam gave me and based on my conversation with her, I've ordered a full mouth series and a CT scan. So that's already pre-programmed, because this goes back to the front desk. The front desk then writes on the schedule what it is that I want when that patient comes in for a first visit. Okay, so now she's coming for a first visit, and these are the assistant notes. So we know that this is what we're doing. All of the things we're doing, you can see it there. Take a look at that blood pressure. Pulse 65, no allergies, high cholesterol, high blood pressure. States that she'll call her physician to see how soon she can be seen to see what is going on with her blood pressure. This all came from the assistant. This is before I ever walk into the room. States her ankles have been swollen and she has gained weight. She presents today to see what her options are to fix her smile. She would love to have nice, pretty white teeth. She's aware that she's neglected her teeth for a while now, but she's now ready to do something. She's been told that she has periodontal disease. We spoke in detail, and she admits to having a poor diet, drinks soda and bread, anything that is fast and easy. So all of that came from Joy before I ever saw the patient. Now Joy comes back and she briefs me, and she tells me exactly this. Here's what we've got. We've got a patient who finally wants to do something, and she doesn't feel very good about her mouth, but she finally wants to do something, and also gives me the details on how she's taking care of herself. So what do we know so far? She was referred by a magazine to Publix. She knows that she needs extensive work. No dental care for several years. Her blood pressure is high. She admits she eats poorly, and she has hypertension and cholesterol meds. This did not come from a referring dentist. It never would have come from, well, I shouldn't say that. She did see a dentist 2 years ago who referred to a periodontist, and she was so impressed with that dentist, she didn't see the periodontist either. But for some reason, she decided it's okay to see me because of what we've presented to the outside public. So she came to us first as the primary care dentist. Probably doesn't even know that I'm a periodontist, doesn't even care. So what are the 4 things that patients want? And those of you who've seen us lecture in the past year know this. They want to be able to smile. They want to be able to chew. They don't want any pain. and they don't want their mouths to stink. If we do all of those 4 things, we've got a very, very happy patient. And some patients, by the way, only want to smile, they don't want to chew, or they only want to chew and they don't want to smile. But I guarantee you, if they can chew well, what a big bonus when they can smile. There's so many people say to us, "Oh, I'm not concerned about aesthetics. I don't really care about aesthetics." You know what? Everybody cares about aesthetics, or nearly everybody does. And so don't fool yourself. It doesn't mean that we need to treatment plan to do veneers in every case. We just don't need to do that. But don't discount or don't necessarily listen to the first thing that a patient says, because nobody complains when they have a pretty smile when they're all done. And that's the way she looks. She's 76 years old. Now, if you didn't look at her teeth, would you say she's 76 years old? I wouldn't. So take a look at those teeth. Before I do an examination, we take this photograph. And we put this photograph up on our big screen TV. And by the way, by comparison now, our big screen TVs are rather small. 37 inches. We thought that was a big deal at that time. Now we need 60 inches, 70 inches in order to be able to do it. Okay? And then we put her on the imaging software, and there she is. Do you think she might look at that and say, "Oh, I could look at like that"? This isn't periodontal. This is, I want to smile, which is what she said. I want to chew. This isn't periodontal. But you see, as soon as you put this picture up there, now you're the hero. Now you are the primary care practitioner. Even if the patient has been referred to you, you are now doing a big favor for the referring dentist, because you've essentially created a crown and bridge case just by doing this one little thing with a relatively inexpensive software and something that probably takes 2 minutes to do. So there's the before and after on the Snap imaging software. And now she says, "Oh, something can be done." Is that nice? So we do the periodontal probe, and you can see the periodontal condition is not all that bad. Okay, a couple 7s on the lower left side. By the way, tooth number 19, it may be non-restorable, and so that 7 doesn't even count. The periodontal condition is not the big deal. As a matter of fact, the referring dentist 2 years ago, if what she says is absolutely true, referred to the periodontist, the referring dentist blew it, because the referring dentist didn't know what could be done for the patient. The referring dentist didn't excite her at all, and so she didn't even show up in the periodontist's office. And how many times do you hear, "Oh, from your referring dentist, oh, I referred her to you, but I guess she never showed up"? Why didn't she show up? Because there's no reason for her to show up. She's asking to smile, and the dentist says, "Well, I'll send you the periodontist first." Okay? So understand, and we all know we're probably seeing maybe half the patients that are referred, probably less than that. But once they're here, now you've got the opportunity to make music with the patient. You can create the symphony right here by doing things that no periodontist has ever done, no general dentist has ever done either. And that's to show her what she can look like. You can do this very inexpensively, and frankly, you put yourself in first position and create a great result, or at least a lot of hope for right there. So let's take a look at the X-rays. In fact, no, let's take a look at the photographs first. So that's what those teeth look like. She's 76 years old. She's finally decided at this stage she doesn't want to look that way anymore. How long has she looked that way? Well, the teeth have looked that way in a more and more deteriorating condition for how many years? You guess. I don't know. There's a smile. So you see what she's up against. She wants help from dentistry. She doesn't want help from Perio. She doesn't know what Perio is. She wants help from dentistry. And so we go across, and you'll see the bone levels aren't bad. Of course, you can see the calculus here. You know there's a periodontal condition that needs to be cleaned up. Of course, that's there. But if that's all you're doing and that's all you're talking about, she's got to see what the benefit is. And frankly, removal of calculus isn't much of a benefit. Oh yeah, I mean, it's periodontitis, of course, a benefit, but that's not what the patient's looking like. How is she going to look better by removing calculus? She may not. Tooth number 14 is in trouble. We'll take a look at that in the CT scan. Okay, tooth number 19 has bone loss. There's actually quite a bit of caries here, which you can't see very well. So now we see bridging calculus, all the things that we're so good at removing, and we're going to remove it, and you see where the cap came off, the crown came off on tooth number 30. Restorable tooth? Don't think so. Now there's plenty of perio to do as long as we understand the perio is on the way to doing something else. And the acceptance of treatment has to do with the something else, not the periodontal treatment. We've got to look at this as what does the patient want? What does the patient want and need? That's what we're looking at all the time. Let's look at the CT scan. And yes, I ordered a CT scan in advance because she said that there were a lot of problems that were going on in her mouth, and she knew that a cap had fallen off, and I'm suspecting implant. So I take a CT scan. Besides that, there are an awful lot of things that we can see. I can't tell you how much endo I caught last week as a result of the CT scan. So we'll look through this. You're looking at the upper right side. This side is the buccal here. You're not going to see a lot. But you are going to start to get an appreciation as to whether implants might be a possibility for this patient. See, the bone is pretty wide here, as you can tell. I won't measure it for you. You can all see it for yourself. And then we get to tooth number 14, and you can see lucency no matter where we go here. Furcations, and the buccal roots aren't even in contact with anything anymore, so we know 14 is going to go. Let's look at the lower arch for a second. And we look at the lower here, and great bone support. You know, if you decided you were going to do a full case of implants, and I'm not saying you should, because we're periodontists, so we know that we can save teeth, but you could certainly be able to give her what she needed. Our brand name is Solid Bite, as you all know, and she would be a solid bite case. But do you think that's what she should be doing? Well, maybe yes or maybe no. Understand that we've taken a diet history, and it really wasn't a careful diet history. Our diet history is a 24-hour history. You say, give me everything you've eaten and had to drink in the past 24 hours. And the patient will list all the things. They'll usually list half the things because they're not going to tell you that they stuffed a box of cookies in their mouths before they went to bed at 11 o'clock. You know darn well that there are many who do. But they'll start to give a history. And when we're seeing multiple areas of decay, that's important because if we're going to choose to save the teeth, we need to get the patient's commitment to changing her diet in order to be able to satisfy some assurance that she's going to be able to keep her teeth. And so that needs to be done up front. And we talk with her about seeing Lisa, who's our certified health coach, to be able to, certified holistic health coach, to be able to start to reverse those trends. So we look at this and we see all of these things. I'll show you the CT scan here, or the reconstructed model using the Anatomized software. Not much to see in this case. You know, if there's something you want to look at afterwards, let me know. But, you know, not a lot to see. Except that now she sees it. And now she sees what she looks like, and she sees a view that she's never seen before. And how impressed do you think a patient is? And I'm not saying take a CT scan for this reason, but once we've taken the CT scan, how impressed is the patient that she actually sees something like this? You don't own a CT scan? Fine. I tell you to pay for the CT scan. It's worth it. You know, all right, you don't want to pay $100,000 for CT scan? Pay the $300 for the truck to do it and get your own software. And that way you have the advantage of being able to show the patient everything that's going on and actually show the patient that, in fact, what you're doing from a diagnostic standpoint is a little bit different from anything she's ever seen before. So they're the radiographs, and we decide that at that point we're going to do a treatment plan presentation. And the treatment plan presentation is going to go something like this. Your teeth are actually in pretty good condition. There are some periodontal needs. You already know some teeth have broken off, particularly that tooth on the lower right side. We can't save that. And by the way, there's a tooth on the upper left side that we can't save either. It's going to be difficult to replace that tooth on the upper left side, but right now I don't want you to put a lot of eggs in one basket. In other words, what I'm telling her is I don't want her to spend a fortune on a sinus lift because that's not where her needs are right now. She wants to be able to smile. She wants to be able to chew. And frankly, that tooth number 14 is not worth a year or year and a half of sinus lift when there's so many other sinus lift implant and crown when there are so many other needs that can be addressed and get her doing really, really well fast. And so when I'm dictating, I'm saying, listen, I think the best, your need really here is crown and bridge. You got great support. We can save these teeth. And we can talk about extracting these teeth, and I'll actually give you those options. But I think we can save those teeth, and you can go to Danielle, and Danielle will give you the options both ways. But let me dictate a few things to Danielle, and then she's going to go back and she's going to speak in English to you after we get all done. All right, Danielle, on number 2, we're going to need a core and crown, 3, core and crown, 4, core and crown, 5, core and crown, 6 would be crown, 7 is probably core and crown, core meaning build up. So same for 8, 9, 10, 11, 12, 13. We're going to take out number 14, and for now, I want the patient to understand that she's going to be able to chew better on the left side, on the right side than she is on the left. Because in the lower, we're going to also do build-ups and crowns on numbers 20 and 21. And tooth number 9 and tooth number 30 is going to come out. We're going to replace that with an implant. And so then she'll have the opportunity then of biting on the right side. And the right side is going to be a lot better than the left. And frankly, I want to save you money right now. I want to give you one good chewing side, and I want you to be able to smile. Is that okay with you? Patient says, yes, that's really what I want. See, the patient doesn't care about replacing number 14. She wants to smile. If she wants to have one good chewing side, right now she has none. She has a loose tooth number 14, and she has a loose tooth number 30. And so we're going to give her bicuspid occlusion on the left side, and we're going to give her molar occlusion on the right side. Do you like the smile that we created for you? And the patient say, yeah. I like what you did. Would you like to have that? Yeah. Okay, well, there's some other things that are going on here. Number one, you talked to me about sugar, didn't you? The patient said, yeah, okay, well, if we're going to save the teeth, what's really, really important is we get away from sugar, because we can send you to your dentist and have all of this beautiful restorative work done, but the same things that cause these teeth to rot away to begin with the teeth are going to rot away again. Just because we cover them with crowns doesn't necessarily mean that the teeth are going to stay. This teeth will rot away under the crowns. And so the things that are causing the disease never go away unless you change that. So how would you like to talk with Lisa? And she's our health coach. Just like a golfer needs help with a golf swing, we all need help one time or another. Lisa's not going to judge you. Lisa's just going to is going to listen to you and understand what your lifestyle is, and is going to give you some suggestions, and you can make some suggestions too, and the whole thing's going to cost $200 for the month. What do you think? And so the patient will often say yes. That's how we make the approach. Now, in order to be able to get there, and again, I'm talking to the patient, you've got some gum problems. There's heavy accumulation of bacteria below the gum line. Remember I showed you this up here? See all of this caked on? That's bacteria that's stuck below the gum line. That bacteria is actually causing this bone to be lost. And part of the success of any case is to make sure that we've got good healthy gums. Well, it isn't really healthy gums. It's we want to prevent more bone loss. You see the bacteria is stuck here, and if the bacteria is there, the bone doesn't want to be anywhere near it, so it goes away. And if we remove this material, it's called calculus, if we remove this calculus, then the body now wants to keep the tooth. So we're going to have to make your gums healthy first before we start any of this. But that's going to be a minor thing that we're going to do on the way to giving you that smile that we created on that photo. Okay? So then it goes to Danielle, but I'm going to show you a couple things first, just before we go. So anyway, we did that explanation, and it takes me about that amount of time. I didn't embellish upon it at all. And then it goes to Danielle, and Danielle is there to close the case. But here's where we are after we do scaling and root planing and extraction of tooth number 19 and extraction of tooth number 29 and 30. Here's where we are now. I'm sorry, 20, it was 29 and 30 because those weren't restorable. So now the periodontal condition is taken care of. And this is after we do perioscopy. And now the restorative dentist gives her this in temporaries. Tell me how thrilled you would be if you started where she was, and this is the way the temporaries are now. Now she can smile. So some long-term processed temporaries are done, and now she'll let us do the implants on the lower right side to give her some teeth to chew on. Now she'll let us do whatever she wants because, you see, we've fulfilled her needs. And now we can restore the case. So with that, Danielle now takes the patient now, and the patient has only seen the snap. She hasn't seen this. This is actually the temporaries. But she hasn't seen this, and now Danielle is going to present the case to the patient.
So basically when it's my turn with the patient, and some of this is familiar because we've been doing these treatment planning sessions for a little while, as we explained in the webinar last week, if you attended, the financial part of this, which is where I come in, is fairly quick and easy because we have spent the entire time during this new patient examination to prepare the patient to schedule and pay. That's what we do from the very beginning. We're finding out what her wants and her needs are. We're finding out the emotional buttons. We're finding out exactly what it's going to take to convince her that she's worth investing in herself. This is her time, and what she's going to be getting out of this. So you can't forget those important points, or going into a financial is going to be nothing short of a failure because they're going to take one look at the number, they're focused on the amount, and then they're just not going to accept the treatment. We sell really large plans here, and our girls are so used to the pre-prepping of these patients to accept that they can look at a treatment plan that's $5,000 or $45,000, and it doesn't make any difference. It's all the same. It's just finding a plan that your patient can accept. So for this patient in particular, actually with all my patients, I get my tools ready. We go into the room. I've already have the plan printed up, ready to go. On the plan, I have pre-written out the options that we are going to present. When it comes to the number amount, it's going to have the care credit, monthly payments, interest-free for a year, interest-bearing, whichever, but care credit option is on there, financing. There's going to be a prepaid discount option to get her excited about saving some money, so you can close the deal today, schedule today, collect today, and then the other option is going to be paying half now, paying the other half later. And as I had said before, options sell. When you're giving a patient options in treatment planning, options in payment, you're letting them have control over this decision. You're not saying you need this, it's going to be this. So it really relaxes them with that. They love having the options. Before I show them that, as I explained last week and before, I'm going to reiterate the value of what we're going to be doing, the options, what the outcome is going to be, which for her, the outcome is going to be a beautiful smile, being able to smile again. That's what she wants. You can tell by looking at her that she takes good care of herself, that the way she looks is important. She's 73. You can tell that she's invested money in herself. So I'm using those tools before I go into the room to make sure that I'm going to have everything that I need to show her value. The X-rays, the CT, the Perio charting with those red lines, that's telling her she's got disease in an area. Photos, the snap, the picture that's going to show her here, and models. So when we sit down, I'm reiterating, okay, so Dr. Sheldon said we could do option A or we could do option B. Either one is going to give you a beautiful smile. Option A is going to give you, going to, for you guys listening today, most of you listening today, you're going to be going to a general dentist, doing part of the work there, which is a bridge, and this is what it's going to be like. And as I said, it's going to give you that smile that you're looking for. It's also going to make you healthier because we're also going to take care of the periodontal disease in the areas. And we're going to do our part, they're going to do their part. You're also going to be seeing Lisa, which is our holistic health coach. She's phenomenal. She is going to be helping to secure your investment by taking better care of yourself and your teeth so that the treatment is going to last a lifetime because you're taking better care of yourself, your teeth, and you're going to have the extra benefits of a healthier body, just feeling better. So I'm going over all that. Before I even get to the numbers, I am going over scheduling. So here's what we're going to do. The first thing I'm going to do is I'm going to set you up to meet Lisa. She'll explain to you what she's going to be doing. She'll go over the sequence of how that's going to work with her. And I'm going to set you up to see her, and I'm going to set you up for next Monday at 9 o'clock here in this office, and she'll meet with you in her room. The second thing I'm going to do is I'm going to set you up with your dentist. For us, it was us. For you, maybe say I'm going to call Dr. Smith's office. We're going to get you set up there. You can meet him, and he'll explain the bridge, and you can start that treatment there. And then I'm going to schedule you to come here to start treatment in our office, which is going to be the periodontal treatment. And what we're going to do with that is you're going to see Rebecca that day. We're going to use the endoscope camera. We're going to go down deep below the gum line. We're going to detect the calculus that's stuck on like barnacles below the gum line, clean out all those areas, get you nice and healthy, dental-wise, and that way you'll be a candidate for normal, regular cleanings to come back for that. And then we'll go from there, which will be the implant, and do the implant in that area. So I'm giving her all these appointments. Now she's feeling established. She's feeling like, okay, we're going forward. We're going in the forward motion. And I'm going through all that. Then I'm going to show her, after I have all that set, I'm going to show her the treatment plan that has the options. And when I show her the plan, I'm going right to the options. So here's what you have. Your options are going to be, you can use Care Credit, interest-free financing for 12 months. Or you can take advantage of the 10% discount that we get when you prepay. That'll save you this amount. And I always say, no matter if it's $100 or if it's $2,000, that is a whole lot of money to save. So if you can do it, I would recommend, of course, that option. Or you can pay some today, some 2 weeks before the surgery, and that way you can break it up a little bit. Which one is more comfortable for you? We can close it at that end. So it's a lot easier when you're giving them that section to choose from rather than looking at this huge long plan with these big numbers on it. You can break it up so it's easier for them to take in. For this patient, and as with all of our patients, I'm always focusing on the smile. We're very excited to give you the smile that you've been waiting for. Our patients are so excited when they finish. With the bridge work for her, I talk about with the bridge work, usually it's almost immediate that you get your smile because you're going to get your temps right away. So for them, within a few weeks, they're going to have an immediate smile. We also do that with our all-on cases, our solid bite cases. We do extractions, implants, and fixed and temporary prosthetics same day. So these are immediate effects, and I'm getting them excited about that. Your surgery is going to be in 4 weeks, 3 weeks, 2 weeks, whatever it is, and you're going to have a beautiful smile that day. It is so exciting. Our patients get so excited about it. So I'm getting them excited about all that. Once we get to the acceptance, we're scheduling, and we're getting the payments all situated. When we're going into pre-op, of course, you're going to cover all the bases as far as their consent, what to prepare for as far as diet after solid bite extraction implants and that whole thing. But your very first thing that you're doing is it's scary for patients going into these financial appointments.
And this patient is going to spend on the order of $45,000.
Yes. It's scary.
And it's going to do the upper first. Now, one thing also is that we didn't give her just this option. We said you can extract all your upper teeth. We put six implants in and do a fixed prosthesis. It was about a $5,000 difference. So she sees, here's how much it's going to cost for me to extract my teeth and replace it with implants. Here's how much it's going to cost me to save my teeth and restore them. And what does that mean for you? It means that you need to come up with a restorative plan as well. And at least come up with a restorative estimate. Not we will see what Dr. Smith has to say. I'm going to send you back to him so that he can come up with his treatment plan. No. You're coming up with a total treatment plan with an estimate of what Dr. Smith is going to charge. Now, do you want to talk this over with Dr. Smith in advance? Maybe you do. But the patient leaves you with your expertise, knowing that you've estimated the entire case. Doesn't mean the patient isn't going to go back to see Dr. Smith for impressions and all of the other things that need to be done in order to be able to get to this stage. But no, you are giving the entire treatment plan. And that way you're not the adjunct, you're the leader. And Dr. Smith appreciates your being the leader because you've already sold a $35,000 treatment plan that Dr. Smith doesn't have to present the first time. And by the way, this is before Matthew was working here, and before we had other general dentists who were working here for a couple of years part-time. This is exactly what we did. We always gave the restorative plan. And that's one reason why referral sources may refer to you, because you can talk about the entire restorative plan.
Yeah, and it's important that you prepare them for that. If not, you're going to have the patients call back and say, oh my goodness, the restorative part was more than surgery, and then they get discouraged and they get frustrated and they just cancel. So it does help when you show them exactly how much everything. For this particular patient, it was in the means of $40,000. And when we show the plan, I do show her, I'm giving her set up with appointments with Lisa, the general dentist, in our office here. So a total amount of the $40,000, this much is going to be for your health coaching for Lisa. And again, reiterate the value. She's going to make you healthier, dentally healthier. She's going to secure your investment all the way around, plus the additional benefits of just being overall body healthy. The other part is going to be with Dr. Smith. He's going to be doing this, this, and this, and this. His part of this treatment is going to be around this number here. Now, your appointment to see him is on this date here, and of course, he'll give you the detailed prices of what it's going to be, but it's going to be around this number. We work enough with him that we're pretty confident that the number is going to be around this area. And then you have our plan here. So you're breaking it up. You're having the high tone. You're very confident in your prices. It's well worth what she's going to have done, and you know it. So you have to relay that back to her in your tone that this is worth it. This is going to be worth what you can be getting out of it. But also, I have heard a lot of our members say that you're so afraid of getting the patient from off the street because you're afraid that the referral sources are going to get mad and think that you're taking the patients, or they're going to get ticked off. How do you think they're going to feel when you give them a full roundhouse bridge work to do their part? That there's nothing scary about that. I mean, they're going to love that you are feeding them with this huge case. So you're sending over this patient. She's going to need crown and bridge work on the upper, some perio work all over, and a single implant. So it's a score all the way around. So you shouldn't be afraid of feeding those referral sources, because that's exactly how they're going to see it. Wow, thanks a lot. That's a great case you just sent to me. So that's something that you shouldn't forget about when you're working with these patients.
So that's it with this kind of treatment plan. That's how we will present it now. All right, so let's assume $40,000. Not everybody can spend that. I mean, obviously she was ready, but it wasn't that she made that decision right away. And there was a little bit of nurturing and a little bit of discussion. And we were using Lending Club, and we were using Care Credit, and we were doing credit cards. I mean, there was a certain amount of financial manipulation that we need to do in order to be able to help her get to the point where she could actually
I don't think that we actually ever mentioned how much time we give our financial girls in the room to work with these cases. We were giving them 60 minutes, and now we give them an upward of 80 minutes per appointment, because we're not just throwing down a piece of paper saying, okay, here's how much this stuff is, do you want to do it or not? You're spending time to really talk with them, get to know them, and help them. When you present a $45,000 plan to somebody, they're not going to whip out the credit card and be ready to schedule. They're going to be, I don't care if they have the money in the account. They're looking for options on how to do this. That's a lot of money to pay. So for her in particular, when she sees the number, it's, wow, that's a lot of money. Okay, well, I don't know if I have that much money to pay for it. Okay, well, that's when we start to help them out with ideas. Listen, we have Lending Club financing. They'll finance up to $40,000 for treatment. We have Care Credit. They'll finance up to $20,000 for treatment. Do you have any credit cards that have Sky Miles, some cash back kind of deals on them? So we're helping them look, do you have any 401ks, investments, anything that you cash in to take care of this, to do something that you've always wanted to do? Is there anything that you can think of? And this is a normal process. Now, this is not just someone walking into the room asking for the money. You've formed this relationship. You're really helping them out. You're spending this time with them. And for her, she said, okay, well, let's try Lending Club. Let's see if they can help me with that $40,000. Okay, so we try, and they'll only approve her for $10,000, which isn't a whole lot when you're looking at a $45,000 plan. She was thinking she would get $40,000 and then she would pay $5,000 with a credit card. Didn't work out that way. So then I say, okay, well, let's just try Care Credit. Let's just see what they'll do for you. Who knows? Let's see what they'll give you. We try Care Credit. They offer her $13,000, so a combined $23,000 that she has there for treatment. Now, with her treatment breakdown, the upper arch was $20,000 for the upper work. So to do some of the additional stuff, the Perio treatment, to do some of the other stuff, it ended up being about $27,000 or so. So we were giving her some hope as we're finding these solutions. Okay, we have the hope. Okay, we have Lending Club, we have Care Credit. Now what else could you do? Do you happen to have any of the 401ks, the investments, anything you can cash in? Do you have a credit card that has a large amount that you can put some money on? Again, cash back stuff, and really trying to get down into the deep of what our options are. So she says, I have a credit card. I could use a credit card. It has $7,000 on it. So as we're going through and we're really using our minds together to think of what we can do, she's excited. She wants to move forward. She does $10,000 on Lending Club, $13,000 on Care Credit, $7,780 on her credit card. So that gets her to the first stage plus some, because even though she can't afford the whole thing, she wants to do the whole mouth. So I think the only thing that she didn't pay in full was to do some of that lower work. So we ended up getting her those answers, and she was very thankful for the time that we spent with her and very thankful for the help that we were giving her. And then we always end that, after she leaves, we end that with a personalized letter. We call back just to make sure everything's okay. You have any other questions? We're very excited for you. And we always make a point to keep that contact when she comes in, which is what patients say after the fact, that we're always so friendly, that it's not all about the money, because it's not. We do have to collect money. They do have to pay for the treatment, but we make a point to make it well worth the investment.
So that's pretty much the way we would treatment plan this. Now let's assume the patient said, listen, I've only got $10,000.
Okay.
What do you, so now I've come up with 2 highfalutin treatment plans. I've come up with extractions, and we're going to do a couple of implants on the lower right. Actually, I think I was going to do 1 implant at number 29 or maybe 28 and make it into a molar and see if that would be enough so she wouldn't have to get 2 implants. We do that a lot, where we take a bicuspid and we make it into a molar. Usually we do it with 29. Sometimes I'll do it with 28. Just to see if that's enough, and you can always get another implant later on. There is that kind of discussion where I'm trying to save her money, and I know you say that's important when I say, listen, I think we can save money this way. But let's assume she only has $10,000. And I've given her this big treatment plan. What do you do then?
Well, at that point, I go, well, usually we come back to you and say, listen, all she can afford is the $10,000. What do you recommend that she does? And usually, I think in this plan, you would say the same thing. Let's just take baby steps then, because our experience, and it's very true, I don't think we ever had a case that didn't do this. If you can get them started with anything, even with a single extraction or a cleaning. If you can get them started with anything, they trust you. They love our office. They love our doctors, our staff. We make sure that we have that impression on our patients. They'll come back for more. You never know people's real situations, their family members, stuff that they have tucked away and they're scared to use. You just don't know. So for her, it would probably, you would say, let's get her started with Lisa. Let's get her started on the Perio treatment.
And let's get the bad tooth extracted.
And let's get the bad teeth extracted. And so that's what I would say to her. Listen, we're going to take baby steps. You're not going to get there tomorrow, but you're going to get there. So let's take baby steps and let's start here. For $10,000, this is what we can do first. Pay it off. We'll start with plan B, then C, then D. So we're working with her to get her started somewhere.
And maybe we can get her started on crowns and veneers on number 6 through 11 or something like that, or maybe 7, 8, 9, 10. In other words, we can start to give her that smile that she's looking for. Always advising her there's going to be more, but this is how we can get started. And that may be enough to get her started. You know, your financial situation is different now than it was 2 years ago, and you were able to afford something 2 years ago, maybe not everything you wanted to, and then you could build onto that. And as long as we're doing that ethically, and we're not, certainly we're not hurting the patient, and we're keeping the patient healthy, then we can build upon some treatment plans. Do some treatment plans have to be executed all at once? Of course they do. But if there are ways that we can build on this patient, we can, with just doing a few crowns, 7, 8, 9, 10, that would immediately make a difference in her smile.
Well, talking about ethically, I mean, there are times when I say she has $10,000, what can she do? And you say, I wouldn't waste her $10,000. If she doesn't have it, then there's nothing really I can do to help her. And I'll tell them that. Listen, we'd be more than happy to take your $10,000 and find something for you to do, but he just doesn't feel like that's where you should spend your money. So it would either be a different referral or something else. We've done that a lot, and they're so appreciative of the honesty. Also, I can't tell you how many times that we've started with $10,000, they call back in a few weeks and say, I was able to get more money, I want to do the whole thing. That happens a lot too. So when you are honest and ethical and you are spending that time to listen to them and work with them, they really, really do appreciate that.
But understand, and I know I don't want to beat a dead horse, that starts with the patient phone call, that then goes to the doctor phone call, that then goes to the intake examination, then goes to the briefing, it then goes to the examination, and it then goes to the financial arrangements person. A lot of work, it sounds like, to get there. But let me tell you, if we do it that way, we get there a lot more often. Okay? So have a great holiday, everybody. We're going to take off. Yeah, we'll be back on January 18th.
18th.
Yeah. So have a great month. Anything comes up,
email.
Email us. That's
there.
right. Danielle will be around. And who knows, I might even answer an email.
He will answer your email.
You never can tell. Have a great holidays, folks. We'll talk to you again in January.